I'm Nurse Valerie with the Department of Public Health, and I'm here to share some important information on how you can protect your family and you from the whooping cough. Whooping cough is a respiratory infection. You may also hear people call it pertussis. Anyone from a newborn infant to an older adult can get whooping cough, but it's especially serious for infants. Whooping cough usually starts off like a cold. Symptoms get worse, and people begin to have sudden, uncontrollable attacks of coughing. A high-pitched whoop may follow the cough. Whooping cough can be serious. Adults and teens usually have milder symptoms. Infants can have convulsions, bleeding in the brain, and pneumonia, and can quickly die without much warning. Whooping cough can become serious very fast, but doctors can treat with antibiotics if they catch it early enough. The best way to prevent whooping cough is to get vaccinated. Infants and young children should get DTaP vaccines. Preteens should get a Tdap vaccine. And all teens and adults who have not previously been vaccinated with the Tdap vaccine should get a dose. Everyone who has contact with infants, including parents, siblings, grandparents, and babysitters, should get vaccinated. And if you're pregnant, get vaccinated while pregnant or before you leave the hospital to avoid infecting your newborn. You can get vaccinated at your regular health care provider's office. Don't have a regular health care provider or health insurance? Well, you can visit www.publichealth.lacounty.gov/IP or just simply dial 211 for a list of low or no-cost vaccination providers. Thank you for your time, and remember to take care of yourself and protect your family and you.